Today we are at MZ Skin London with Dr. Maryam Zamani, oculoplastic surgeon, aesthetic doctor and founder of MZ Skin. Maryam, welcome to the show.
Thank you so much for having me.
Today we are going to talk about a topic that's very close to women after 40, skin laxativity and tightness. Maryam, is it true that after 40 we lose collagen and the skin starts to become loose and creepy?
I'm sorry to break it to you. It starts in our mid-20s.
Oh dear.
Yes, we start losing about 1% of our collagen every year after the age of 20. And unfortunately, in the menopause period, actually you can lose up to 30% of your collagen in the first 5 years of menopause. So it can be very dramatic.
And what are the earliest signs of skin laxativity?
So I think the aging process of the skin can be seen in many folds. It can start with little things like the pores become more noticeable, or that your skin looks lackluster. You start to get very fine lines, or you might see that the skin doesn't have as much density as it did before. I think those are probably the earliest signs where you might just feel that you look tired.
Okay, but because this is for, loss of collagen, is it true that if I start to take all these collagen supplements, all of a sudden after a month, I become, my skin becomes tight and
like
I
a 20-year-old.
Yes.
So everything you have to take with a grain of salt, of course. I think, we just have some new studies that show that collagen peptides, hydrolyzed collagen peptides do actually work. Now, is it because you're more conscious about what you're eating and drinking and doing with your body? Is it because of the actual, hydrolyzed collagen? Or is it a combination of anything? It doesn't matter. If it's helping you in some sort of way, I think that's a plus. No, you are not going to go back to your years when you were 20. But what it does is that everything that we do is to optimize your health and your skin at this particular point. So, I was telling you before we started, I had the fortune of starting a collagen supplement and actually a vitamin supplement made by a colleague dermatologist in Ireland called ID Formulas. And I did it for 3 months, wore Whoop. It was actually quite an interesting experiment. Loved the drink, by the way, because
nice.
It tasted nice, which normally no sugar, and it did. Normally they don't taste very good, and you don't want to drink what's in front of you. So was it because I was drinking more in addition to it? But I felt great. My workouts were better. I felt my skin looked good, and I thought I was doing something good for myself, and so that actually also helped me in terms of my mood. So there's a lot of plus benefits if you start believing in that positivity. You will also see positivity, I think. But anyway, back to the point is that I really liked this formula. I've tried many in the past before, have always given up, and I stuck by this. And in fact, when it ended at month 4 and there wasn't any more in production, I was desperate to get my hands on more. It hasn't even launched yet. I messaged my friend dermatologist, when is it coming out? So, I think there is something to be said about that.
So collagen banking is not the biggest scam?
No, collagen banking. So this is an interesting concept. I think, people make it out to seem different things for different people. But in reality, collagen banking is that you're stimulating your body to create more collagen. Does that mean when you're 40, if you did collagen banking in your 20s, you're going to have more collagen? No, it's not that it's on reserve waiting to be tapped in when you need it. But what it does is that it gives you a good starting position. So if you're doing something like microneedling, which can help increase your collagen and elastin production, then your skin density is going to be better than if you didn't do that. And therefore you have a better starting point. So even with the gradual progression of collagen loss, you will still be better than if you had not done it. So I think it's just the way that it's explained to us. It is not, you're not going to put it in the bank for a rainy day. Let's just put it that way. But it'll just give you the best skin now, and it will help you have better skin for the future.
So it will help.
It does help.
Fantastic. But if, say, you have a patient, I come to your clinic and I say, Dr. Zamani, my skin is sagging. What do I do to make it better without surgery?
So it depends on, you don't have much skin laxity. I think it really depends on your expectations and where your starting point is. Mm-hmm. So if you have light skin laxity, say the 30 to 45-year-olds, I would say that range can be anything from, just doing a light Morpheus 8 or a all-therapy or a soft wave or some technologies, energy-based technologies that help to tighten the skin of the lower face by stimulating collagen and elastin. I think those are nice treatments to do. Microneedling, for instance, I love it as a collagen boosting treatment. So I do recommend it for my younger patients who often want to come in and do something more elaborate. And I'm like, you don't need that yet. Keep it for when you need it.
Which laser works best?
It depends for what. So like I said before, so I love lasers. I have erbium, I have 1064, I have CO2, I have combination lasers as well. And lasers are basically great for more for topical. So they're great for fine lines and wrinkles. The more aggressive ones are great for even static, deeper lines and wrinkles. You can get a full face rejuvenation. They're great for pigmentation. They can be great for redness, facial telangiectasias, the little blood vessels. They can even be used for the purple blood vessels. So I think those are amazing resurfacing treatments. And of course, you get tightening of the skin with the heat that comes with it. Not everybody can do those lasers depending on your skin type and what the issue is at hand. But I do love them for those reasons. Light treatments like BBL, IPL, which you may have heard about, those are also good in certain patients with pigmentation and redness issues, rosacea, hyperpigmentation, just photo damage from sun exposure.
But for skin tightening on the jawline, what's your favorite?
So then I would use the energy-based treatment. So I love for the actual jawline, I really love all-therapy. I like it more than soft wave or ultraformer, which are other ultrasound-based treatments. I think it's the gold standard for skin tightening. It's one treatment. It's slightly uncomfortable. I always recommend, over-the-counter pain medication like paracetamol and ibuprofen. It's a one-time 45 to 1 hour treatment on the lower part of the face. You can also do it on the neck. I think it works the best on the jawline. And you can get a nice lift on the jawline. So I think this is great for the younger patients. I started doing it at 39 and I probably did it 2 or 3 times. No, I've definitely done it more than 2 or 3 times. I've done it every 2 or 3 years, 1 to 3 years. And I really do love that treatment. Some people worry in some of these treatments that they're losing fat. So I just want to address the elephant in the room. Essentially, it goes to a certain depth and the person who's doing the treatment, it's very important who you choose because it's not the technology that's just working for you. It's the combination of the person who's doing it in conjunction with the technology. And so if they are not well versed in how to use this treatment well, yes, you could. Now, sometimes you do want to have a reduction in the fat in the face because as we get older, our fat compartments descend and come downwards. And that's why we get some jowling and some skin laxity in our lower part of the face. So actually having a little bit of that removed with, or, melted with a little bit of all therapy does help. Now, that is where the nuances happen. So you wouldn't want to treat the whole face in the same way as you'd want to treat those little areas. And I think that's the nuance of going to someone really good and having a treatment. So sometimes people come in and say, oh my God, I had this treatment. It was the worst treatment ever. And they might not have even had the treatment that they thought they were having. They just think everything is the same. Soft wave is the same as all therapy is the same. But yes, they are similar, but they're not the same.
And it depends what skin type you have, what problem you have, and address it, correct?
Yes, and also the person who's doing it. I really think that is the key. And also the expertise, So, the difference between one person doing a procedure and another is really that experience and how they've used their experience to really make it, very specific in how they're treating the patient.
And what about the eye? You are the eye expert. And around the eye is where we age faster, right?
Absolutely.
What do we do?
So this is actually notoriously a very difficult place to treat, and it depends on what. So early stages, people notice, fine lines and wrinkles that are caused by dynamic movement when they're smiling, and they see that, when they're in a picture, they can barely see their eyes because they shut closed because they're just been squinted. So unfortunately, as we get older, there's a few things that happen around the eyes. So the bony structure of the eyes changes. So your eyeballs never change size. But what's happened is that they move. And so the eye actually sinks in further. So those big eyes that you see in children, it's not that their eyes have gotten smaller as they get older. It's just that the bony structure has changed and they fall back a little bit. And then sometimes I can push the fat forward when you can get like, puffiness in the lower eyelid, sometimes in the upper corner of the eyelid. It's universal. It's like gray hair. Everybody gets it eventually. And then there is volume loss and descent. So the area around the eye, it comes downwards. The fat that used to make it very confluent here, you start to see what's called a tear trough. And, it can make us look a little bit more aged in conjunction, with the brow starting to fall, the temples hollowing. So there's a lot of different changes that go on. So neuromodulator like Botox, Dysport, Azelor, great for the fine lines and the crepiness around the eyes. For tissue texture, that quality. So I don't do many blepharoplasties on the lower eyelid where I remove skin because actually it's, especially in the younger population, it's not that they have too much skin, it's the quality of that skin. It doesn't have the same density as the rest of the skin on the face. It doesn't have the same oil production. And remember, we're blinking, we're chewing, we're emoting, and all of those muscles around the eye are contracting thousands of times a day. So just that movement is creating, a wear and tear of that collagen. So that's where things like microneedling can help. I love laser resurfacing. I love ablative CO2 and erbium for the lower eyelid. It helps to coagulate and tighten that skin. And it also helps decrease the appearance of the fine lines and that crepey skin that starts to happen. And then there's the question of volume. So volume, there's lots of wonderful things we have, from polynucleotides to skin boosters to hyaluronic acid and then to fat. So depending on where you are in your journey and how you wish to address it, there's a lot of different options.
And what about fat transfer for volume?
I love fat transfer for volume. I think it depends on, again, where you are. So I wouldn't necessarily recommend that to a younger patient who doesn't have much volume loss. Remember, it's a surgical procedure. It's a short surgical procedure. And, now we use microfat in that area and sometimes even some nanofat, which is beautiful. There's a few, you have to look at the pros and the cons. So hyaluronic acid fillers, the pro is that you can do it in a quick office procedure. You can restore volume. It's something that is temporary. It can be long lasting, but it generally is temporary, and it can be reversible. And those are all the positives. Now the cons, of course, you can get a little bit of bruising or swelling because it's an injection that goes away. It's not,
that's normal.
It can be normal. And, it's not permanent. So in some people, if they're very, sporty or they're very thin, they can eat up that hyaluronic acid quite quickly. There is a small subset of people that can get swelling in the lower eyelids. I'm actually one of them. So I've tried many times with, all of the best colleagues that I have. And, sometimes I'd go to the mountains, my eyes would swell. Sometimes I'd have salty food. I'd go to sushi, Chinese, my eyes would swell. And I could see exactly. Yeah, I could see everything every time because my face is relatively slender. So unfortunately, I dissolved it. I don't have anything underneath there. But then the con of that is that it doesn't last as long as well if you do like it. And sometimes with filler, I tell patients they look good until they don't. And so they can go like 2, 3, 5 years. And then all of a sudden they're like, it doesn't look as good as it did before. I feel like I'm a little puffy. And then we dissolve it and then we readdress it at that point. Okay. Now, the pro of fat transfer is that, you're less likely to have an issue because it's coming from your own fat. The downside is it's surgery. So you have to take a little bit of time off, at least a day. There's an incision where you can take a little bit from the thigh or the tummy and introduce it. You don't need a lot of fat. You might struggle to find
Yeah, exactly. My question is, you read my mind. Can I do fat transfer even if I'm skinny?
Well, yes. Generally, the GLP-1 takers, who've lost.
I don't take it.
You're just generally a teeny person. I'd have to see you naked, but you don't need a lot of fat to address something like the under eye areas. If you're doing global fat transfer, you'd need more, but we can generally find a little bit to take. Then it's a matter of how long is it going to stay. So the one thing about fat is that it's not as predictable as a filler and it's not reversible. So if for some reason you don't like it,
you're stuck with it.
You're stuck until the body resorbs it. And we don't know how much of it stays and how much of it doesn't. It can be anywhere between 50 and 80%. But the nice thing is fat also has lots of stem cells in it. So it's lovely to help just rejuvenate the skin and it really improves the quality of the skin.
Fantastic. Thank you, Maryam. So Maryam,
Yes.
the worst part for skin laxativity, in my opinion, it's the body. So, people often say, I lost so much weight, I had pregnancy, and the tummy is going really loose, and the skin and the tummy is creepy. But I didn't have children. I am not menopausal yet, and I am the same weight for 20 years, and still I have skin laxity on my tummy. Why? And what do I do? Or what we do?
This is very difficult. So this is worse if you are wearing, a sports bra and you do the plank and you can see the skin on your tummy, on your knees. That's why I'm always in long, leggings, and I never show anything above my knees.
No crop top for me.
Even my crop tops are basically go to my belly button.
Yeah.
My trainer always like, are you a grandma? I'm like pulling up my leggings and I'm pulling down my top. But the reality is that skin laxity on the body, remember the skin is thicker on the body. It also has different composition of oil glands, and there's a lot of it. So, the thing is that you need a little bit of laxity in order to be able to raise your hand and, do certain activities.
Same for the eye, in fact.
Same for the eyes, yes. But then with time, there's a few things that happen. So we often lose muscle mass, not you particularly, but as we get older, we lose some of that muscle mass. So maintaining that muscle density is always going to give you the best skin. And then we usually don't take care of our body skin the way that we have our face. So sun protection is number one, always. And then also using actives on your body. So one of the important things is, I was thinking about doing a body care line a few years ago, and I actually did create 2 amazing formulas, which I use on my body sometimes myself now.
Why don't you share?
Yeah, because I'm not allowed to sell it. Because
not yet.
No, because actually, interestingly, because of the surface area of the body, the actives that we have in body skincare is not as strong as what we have in face skincare. So remember, this is a much smaller surface area. And so if you have a retinol, which is great for helping produce that collagen and elastin, helping with the pigmentation, lots of benefits for a retinol, a retinoid. But on the body, because it's such a big surface area, you'd be getting so much that it's not possible, safety-wise to be able to use that. So even the ingredients that we use for the face are watered down, basically, when we use them for
What
the body.
are the ingredients? Which are the best ingredients that we can find on the skin, on a skincare line?
So I think, for the face and the body, it's actually the same in different things. I would say the basics are a retinol. You don't need, for me, it's not about intensity. You don't need to be on a prescription one for the body. But if you're getting a little bit every day, that consistency will always outweigh, the intensity. I love antioxidants. There's a lot of them out there, vitamin C, vitamin E. Those are just the ones that we all know about. Again, it boosts the collagen and elastin, also help with pigmentation. And then hydration. So as you get older, you said you're not there yet, but I can see that the dryness or that, the dewiness of my body skin has also changed. And so for me, making sure there's good hydration, I actually use some urea on my body. I love, ceramides. Excuse me?
Tretinoin.
Tretinoin?
Yeah.
Tretinoin is a retinoid, so that's vitamin A. So that's like the retinol. That's the strongest version is a retinoid, which is a tretinoin. That's prescription strength. You could use that, but you would use less of it, and then to be able to get the surface area would be difficult. Yeah. So actually, if you have a retinol or retinal in your body care that's consistent everywhere, then that would probably be better, because a retinoid, it would be very difficult to use everywhere. So things that improve hydration, improve the skin biome, and also lock in that hydration, and also help to exfoliate some of the dead skin. So,
but for the laxativity on the tummy, and also the knees, because also the knees, it gets really like loose skin.
It does, but look, if you did that and you looked at your knees while they're bent like this, they're not so bad.
No, but if you're standing on a mini skirt or in your bikini, then maybe you have a problem.
Yes.
So can we do laser there? Can we do
So there's a lot of
exosome?
things,
What can we do?
Okay, so there's a lot that you can do. So when you're younger and you don't have those lines and wrinkles, it's not just because of the skin, but it's also the quality of the fat that's underneath it. And as we get older, the quality of that fat changes everywhere. Those fat pads when you're young are so yummy, you know, they're like squishy
juicy
and pink and juicy. You know, look at a baby, their cheeks are just bursting with that beautiful baby fat. And their body, you know, you look at the Michelin tires on their legs, but that fat is just like nice and, like you said, juicy. As we get older, that fat is not juicy. It becomes, sometimes it can become like thicker, it can become flatter. And so the quality of the fat underneath it has changed. Your muscle density has changed. And then you've had cumulative sun damage on your body for many years, and then wear and tear. So there's a lot that's going on. I tell my patients there are definitely things that we can do in the office. I love biostimulators like Julaine Sculptra.
For the body?
For the body. I love it for the arms and legs. I like Profilo, but I use it in conjunction with microneedling. So Morpheus 8 for me, I love it for the neck, very light, but multiple treatments. And then in the body, I like it stronger. I love it for the abdomen, above the knees and the arms because it helps. And then sometimes I mix it with Radius, diluted Radius, which is a different kind of dermal filler that is not made. It's made from a different material than hyaluronic acid, and it helps create scaffolding for the skin. And then there's also, you know, ultrasound can help too. All therapy can help as well.
Radiofrequency?
Radiofrequency. We use M-Sculpt quite a lot. The issue,
yeah, this is good as well. You should electrical stimulation of the muscle.
Yes, and also with radiofrequency. So you're improving the quality of your muscle, and then you're improving the skin simultaneously. Now, the only downside to those things is that you need maintenance. And so, you know, it becomes difficult to do everything.
And expensive.
And expensive to do it. So it's a matter of, you know, how much you want to invest in it, time, money, and effort. So you will get an improvement, of course, but in order to maintain the improvements, you know, it's like having gray hair. Once you have them and you start dyeing them, something you end up doing
once a month.
Yeah, in the long term. So it's not something that you do once and then you let it go. So the same thing with the body and the face.
I have another problem. So I was on a date in Monaco, and I was wearing a boob top, a tube top, and this guy was like, "How old are you?" I was like, "I don't tell you my age." And he's like, "Francesca, I can see the age of a woman by looking at the underarm." And I'm like, I don't know if this was a compliment or not, so I just left. And that was the end of my date. But then looking back, because, you know, if you have implants like I do, it can be that, you know, you have the little skin that it gets wrinkled and a little bit not nice. But it is true that we get age there, and you can see aging under your arm.
Yes.
You know?
So not just in implanted patients, by the way. So everybody gets that. It's just a matter of the skin coming upwards. So whether you have implants or you have genuinely larger breasts, obviously with age and time, things start to descend there as well. And so that skin has stretched. And so if you are using any sort of bra that lifts your breasts up, you will have that skin laxity start to show. Now, some people also have bra fat. We call that the bra fat area, and that can be treated with, you know, with something like Cool Sculpt, a little bit of lipo.
But then you have even if you're young, right?
Yes. So the bra fat, yes, exactly. But that's very difficult to treat because if you are not wearing something that lifts the breasts up and they're down, the skin actually looks fine. It's just when it comes upward. Having said that, now that I'm, you know, in my 50s, when I wear strapless, or not even a strapless, I don't wear strapless anymore. But if I wear sleeveless, I can see the skin right here. And, you know.
It's not nice. What do we do?
So that's where M-Sculpt helpful, you know, skin biostimulators helpful, Morpheus 8 with microneedling. But again, you know, it can be a full-time job. So it's a matter of how much you want to do. And then, of course, there's surgery, but that's very invasive. And for me, I don't think it's bad enough to warrant a scar in that area, you know. And you know what, frankly, I can wear long sleeve shirts.
Yeah, exactly. Long sleeve is perfect and it's sexy. See-through, it always works. And talking about lifestyle, do you think if you have a woman does a lot of treatment but a bad lifestyle, versus a woman who is her lifestyle is amazing but she doesn't do any treatment? What works best?
Lifestyle, 100%. I mean, look, obviously it's a combination of everything, but you know, you can't, it's much better actually for your quality of life and your longevity of life to have the better lifestyle. You know, good sleeping, good nutrition, exercise, hydration, you know, supplementation where you need to be. You know, aging is a process that's going to hopefully happen to everyone for a long time, and how you decide to deal with it is very personal. You might want to throw the kitchen sink at it. You may want to do, you know, dip in and out, but there's a whole menu. You know, it starts from nail maintenance and getting manicures, to dyeing your gray hair, to going to the gym to maintain your muscle mass. So, you know, all of that are conscious decisions that we're making, and they are way more important than what I'm doing in my office. I always say what I do in my clinic or even in the operating room is the icing on the cake. If you want to have the maximal impact, you should be trying to implement the other things. Obviously not perfectly, but if you can do it more days than not, you're in a pretty good trajectory.
Because actually, if we are eating sugar, it kills our collagen. So one of the main problem of a lack of collagen is eating sugar, junk, or drinking alcohol. Am I correct?
Absolutely. You know, I always think of it, we all have a little bit of alcohol and sugar. Obviously, you can't live life, you know, and stay away from those things. But would you give your dog or your cat alcohol?
No, but I don't take it myself either.
Okay, well, you're an exception. So, you know, I drink a little, not very often, but, you know, I would never give a pet that. Why? Because it's not good for the pet. But we don't think of that for ourselves at all. And so
for a young child as well.
Yes, exactly. So, I mean, I think absolutely, you know, sugar is the enemy. And sometimes what I do notice, and I can be that person too, is that because I get busy in my day and all of a sudden I go from not having anything to be starving, and I eat anything that's in front of me. And, you know, normally it's not a healthy salad that's just in front of me when I'm starving. It's, you know, that piece of chocolate or the candy, and I reach for that because I just need something in that moment. So I've gotten better as I've gotten older, especially as I turned 50, to have something on standby. And actually it's nice in my office, you know, my assistant just sees my face and she's like, I'm getting you food. I'm like, yes, please.
That's so sweet.
And then, you know, or I just tell them, you know, every 2 hours, bring me another glass of water, just so that I always know that I'm doing something, because we can get busy and it's not my intention to have the junk, but in that moment, you know, I do whatever it is that I need to do. My biggest evil is Coke Zero. I know,
that's
I know,
the worst,
so
Maryam.
I know, it's so terrible. Everyone has to have a vice. That's my vice.
Okay, but not Coke Zero.
Coke Zero, it is Coke Zero. I know, it's so terrible. I should probably even go to full fat, but I don't want to have all the sugar. So Coke Zero, I will eventually
move away from it.
That too.
What are 3 secrets that you can give our audience on maintaining a long-lasting, youthful and tight skin?
So, you know, I think the most important, well, there's a lot of most importance. I think lifestyle is the most important, and stress being one of them. So you can hide it from the world if you're feeling stressed in some people, but you can't hide it from yourself. And it's hurting everything in your body. So it's not just your collagen, it's your organs, it's your immune system. So I think that lifestyle and making some time for yourself to meditate, exercise, whatever it is that brings up your endorphins and takes some of your stress away, I think is very important. I think skincare is incredibly important. I don't think we give enough value to it. And in this day and age, when you have a new product launching probably every minute, essentially, there's a lot of confusion. And I think consistency over intensity is very important. And making sure you stick to that routine, because sometimes people say, oh, I don't see a difference, but actually it takes 6 to 8 weeks to see a difference with any product. And
consistency.
The consistency is so important throughout your life with whatever regimen that you're doing. And just keep it simple. And I think the third is to protect your skin. from all the bad things. So that's with SPF and also with nutrition and diet. So I think those are, it's really everything is about a lifestyle.
But
Skin
also
and looking your
treatments,
best.
no?
Well, the treatments are the icing on the cake.
Yeah, like the cherry on top.
It's the cherry on top. But what I don't like, and there are plenty of people who do this, they go, and truth be told, I was one of them at one point. I loved the sun, and so for many years I was, maybe 3 shades darker than what I am now, and I loved being tan. In fact, when I married my husband and I moved to London and it was gray for so long, I became the color that I am now. And he said, I thought you were like a darker Iranian. And I was like, I'm so pale. And so I loved that. But, I have a lot of sun damage from that. And I spent a large part of my 40s getting rid of pigmentation or improving my pigmentation. I love treatments. I'm a big proponent of everything that I do in my office. If I have it in my office, it's because I would do it myself or I am doing it. I have a fractional CO2 or erbium laser every single year, sometimes even twice a year. I do lighter treatments at least, I do something every quarter.
But you look so good. So what is your secret? What do you do for yourself?
A little bit of everything. I mean, really a little bit of everything. It's not one magic. I think that is the biggest thing, is that people think that if you have one treatment, you're going to be perfect. It's really a culmination of everything. I love to exercise. For me, it's a form of active meditation. Francesca sees me at kicks,
every day.
at 9 o'clock at night. There might be no one there, and she'll be having her dinner, and I'll be walking in to do my workout. So, for me, it makes me feel good. It helps maintain my muscles. I'm moving.
And your brain as well.
It shuts me off. And, I generally like to eat well. I'm very fortunate. One of the things I learned with my Whoop is that actually I have great sleep quality, despite the fact that I might not sleep 10 hours every night. And that alcohol really is the Knievel for me. The minute I have not even a full glass, like a little quarter of a glass of champagne, my sleep nosedives. And my readiness nosedives, everything nosedives. So I'm very affected by alcohol, which is why I very rarely drink. And of course I do great skincare with my products. I'm always creating products kind of based on my own trajectory. So, in the early days and still now, pigmentation has always been front of line for me to have skin clarity. So my products are very pro-rejuvenating in that way. Hydration, because even before perimenopause, I am just a dry person. So I always wanted that hydration without feeling greasy, because let's face it, who wants to look oily and greasy? And, now that I'm getting older, I'm noticing more on my body. I'm noticing my hair. So, it's a combination of things. But like I said, every September I do a fractional erbium laser.
I know, I see that on your Instagram.
Every year without fail, like a couple weeks after I'm back from summer. I am doing treatments for my hair right now. I do also some microneedling in between, because that's an easy, quick way. Look, I don't mind walking around looking like funny and scabby or swollen and all of this stuff. I just talk about it. Actually, very funny. I went to a very big opening at for a beauty brand, and I did a fractional CO2 laser 2 hours before I went there. Everybody was all glam, and I was pink with little dots on my face.
And everybody loved your makeup.
They said, you look so well. I said, no, I'm looking puffy because of the laser. But anyway, I'm not afraid to walk around doing that. And
because there is some downtime.
There is some downtime. And that's the thing, there is some downtime. But there's no magic one, it's a lifestyle. But it's a lifestyle without letting it get to you too. So I do all of those things, one, because I love it, but two, because it's also fun for me. It's not a chore. So once it becomes like, oh, I have to do this, no one really wants to do it.
There is no pleasure. I have one more question for you. You are talking about perimenopause, menopause, and what biologically happens during the phase that the skin goes loose and creepy, among the other things that happen during menopause?
Hormones are really, really important. So hormones are really important. We have estrogen, progesterone, testosterone. Testosterone helps us maintain muscle mass. Too much of it is not good. It can cause, hair loss. It can also make you angry. It can give you acne. All of these things come with nuances. So it's important to be followed, particularly in the early days until you've stabilized and are in menopause, so that you can actually tweak, the formulations that you're using.
Because testosterone, I learned during my podcast with Dr. Ofena, that is actually not good in fertility. Too much testosterone can be not good to a babies.
Yes. So yes, absolutely. So there's a lot of different nuances. So you do need to be monitored for hormone replacement therapy. And then you have progesterone, which is one of those things that, makes you sleep really well. So you see a lot of women have sleep disturbance in their perimenopause and menopausal phase. And that's because their progesterone is flatlining. And so, giving some supplementation with that helps. Again, if you're not getting good sleep, your collagen is not, replenishing. Body is not detoxifying. I mean, so much happens when you're sleeping, in terms of the MOT of the body. So if you have interrupted sleep or you're not sleeping enough, you're going to be grumpy. You're going to look tired. You're going to feel tired. You're not going to be able to work out well. You're probably going to eat worse. So it's like a snowballing effect. And then estrogen, with the collagen. So that's why we lose almost 30% in the first 5 years of menopause, is because we've lost that estrogen, and that is the supplement that gives us that radiance. And so, I'm a huge believer in it. I think it's a very personal, decision that people want to make. One, they need to make with their doctors if they have issues of certain cancers in their family and they're worried. So I know that is, we are obviously coming out of that, but there is still that fear there for some people. For myself, I started, like I said, I'm not in menopause, but, my first symptom was I would go from 0 to 100 in faster than the Ferrari that just went down the street. So,
Grand Prix.
Yeah, exactly. So, all of a sudden I just realized, and I would know that my reaction is so significant relative to the issue at hand. So that was the reason that I started it. And, I can see that has actually helped me so much more. But I think, I think those hormones are really important. By the way, not just for women, but for men too. There's hormone replacement for men as they get older as well. So, the world of longevity has come a long way. Mm-hmm. I know it's a trigger word right now.
The most used word ever.
The most used word. But it's something I've been thinking about, in my medical practice and in my skincare line since the inception. It's always about how to have the best life you can have now so that you can have the best life you can have later. It's about doing these little things as you're younger to have it last for as long as possible as you age. So you age well. Because obviously we all want to age. We want the life to be as good as it can be for as long as possible.
Younger for longer.
Not younger. Just, you can't go younger. Sometimes.
No, but you can maintain what you have.
Maintain.
So.
You have to maintain, and you have to be accepting that there's beauty at every age and at every stage of life, and it may not look the same as it did when it was 30. Mm. And that's okay. So coming to that realization, I think, is really important. I went to see a friend's granddaughter the other day, and I just thought, what a beautiful new stage of life. I was like, holy moly, I can't believe I have friends whose kids are having babies, because I started my own family a little bit later. But at the same time, what a beautiful time of life. So
what a beautiful gift.
Yes, what a beautiful gift. So I think you just have to know that it's going to happen. It can be difficult, but there's a lot we can do to give it for a run for its money.
I think today's episode we really learned that skin laxity is due to loss of collagen, poor lifestyle habits, and we can improve it to lasers and fat transfer and some collagen stimulation injection, but also looking at our lifestyle, eating healthy, sleeping, exercising. So everything together
it's a
really
holistic
works.
Approach.
Yes.
And in the right person, surgery too. I mean, you never say never.
And the body, it is more difficult, but it is possible. So please don't feel disarmed. Work, be consistent, and you will see all the results.
You will indeed.
Thank you, Maryam.
Thank you so much, Francesca.
It was so nice to have you on the
Thank
show
you.
and for many more to come.
Hopefully. Thank you.
Ciao.
Bye.